There's been a lot of attention on tax subsidies for health insurance and Medicaid, but that hasn't been the only healthcare discussion in Washington. Congress is drilling down into the nonprofit status of many hospitals and health systems. This week, we'll catch up with the latest. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Tim Nelson. In this episode, we're talking with Becky Wifstrand, Director of Federal Policy and Regulatory Affairs at the Minnesota Hospital Association. I asked her about a recent House hearing that raised some important financial questions about hospital care last month.
So the House Ways and Means Oversight Committee had a hearing on September 16th looking at tax-exempt status for hospitals and community benefit spending. And this actually isn't the first time that this committee has looked at it. They also had a very similar hearing in April 2023. And a lot of the discussion at the hearing was just concerns about nonprofit hospitals abusing that benefit and that tax-exempt status and not truly spending enough on community benefits. They talked a lot about specifically the IRS Form 990 that is required by the Affordable Care Act, where all of our nonprofit hospitals report on their community benefit spending. There's concerns that it's not specific enough, the requirements in the form, it's not transparent enough. The hearing also did include some witnesses that were concerned that some of this money being spent by nonprofit hospitals were used for diversity, equity, and inclusion efforts, as well as gender-affirming care. So there were some political discussions in terms of some of those more controversial topics. But overall, I would say that the hearing was pretty performative, but interesting that they're focusing on, nonprofit hospitals in this way.
And they weren't just talking about paperwork and getting all the tax forms filed. I mean, they were talking about perhaps changing nonprofit healthcare or doing away with nonprofit healthcare. I mean, there were some pretty serious questions raised in this hearing.
Yeah, and I think it reflects the current makeup of Congress right now and the current administration, that focus on waste, fraud, and abuse, that concern about wasting taxpayer money. And so we know that healthcare uses a lot of money for good reason, given the needs for patient care. But I think they see this as somewhere to focus on, somewhere where they could pull the strings a little bit. And again, I think that idea of wanting more transparent information is really a priority of a lot of the leaders in Congress right now.
And Washington isn't the only place this has come up. There's been quite a bit of discussion about this here in St. Paul. The legislature has been scrutinizing it, even asked the Office of the Legislative Auditor to take a look at this in hospitals in Minnesota. What's the local history on this?
Yeah, so most recently, as you said, it's been talked about for years in Minnesota. But in 2024, there were some changes made in that nonprofit hospitals are now required to submit to the Department of Health their community health needs assessment, which is required by the federal government every 3 years. But now the state's going to be collecting that as well. And as a part of that, they're asking for an addendum that requires hospitals to drill into some of their community benefit activities a little bit more specifically. So this new requirement starts actually in January 2026. So MHA has put out a lot of education in terms of what that looks like, and a lot of our members' leaders are working on that. But that was really St. Paul's solution to trying to get more information, is getting that transparency. But back to the federal level as well, this isn't kind of a new scrutiny. There was some federal reports put out as early as 2020, kind of asking Congress to look at more specific requirements around community benefit. And then the IRS was doing some increased auditing of hospitals last year. So this has definitely been swirling around for several years. And I think we're really honing in terms of trying to give more information.
And Minnesota did, I think, do one of the first reports in the nation, a real intense drill down into this issue by the Office of the Legislative Auditor, right?
Exactly. Yeah. So our Minnesota Office of Legislative Auditor was tasked with doing this report, and they released those findings in February of this year. And they found over a 5-year period from 2019 to 2023 that nonprofit hospitals generated $7.4 billion in community benefit. and that their estimated tax obligations were only $3.7 billion if they were for-profit status. So you can see that the community benefit is far outweighs that tax benefit, and really showing that our hospitals are really owning up to that requirement and really giving a lot to their communities. MHA has also done a community impact report for several years and shows similar results. So our most recent one showed that our hospitals provided $6.2 billion to communities in fiscal year 2023. And that difference from the legislative auditor report is just because of some of the categories that MHA uses in our impact report. But again, that overall message is that we are showing that our hospitals are giving back billions and billions of dollars to their communities. And this takes form of many different things that are outside their purview of just that direct patient care.
So while there may not have been substantive policy changes on the table discussed in the House in September, as we know with Congress, they often start out with asking questions and get to policy changes later. So what kind of things should we look for in the future? Are they, proposing any changes? What kind of changes do you think they might consider? Give us a little look into the future here.
Yeah, so right now, obviously, they're very focused on the effects of the One Big Beautiful Bill Act with the significant changes to the healthcare system. But I don't think it's crazy to think that there may be some changes in some of that IRS reporting that we already do as nonprofit hospitals, changes to the 990 form, requiring more specifics on the community benefit spending. As we just talked about, this is something that's happened on the state level. So I could see this happening on the federal level. I don't see them going to that sort of nuclear option in terms of considering taking away nonprofit status from hospitals, but I do think there could be more effort around transparency efforts. So I would advise our hospitals and health systems to just really continue talking about the community benefits that you're providing and document as much as possible, because we know you're doing all of this, but you need to be prepared that if the federal or state government asks for more information, you're ready with that.
Always a great plan. Well, I look forward to hearing more from you as this develops, and thanks for the update.
Thanks, Tim.
Again, that's Becky Wifstrand, Director of Federal Policy and Regulatory Affairs at the Minnesota Hospital Association. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.